We have decided to proceed with a type of medication called opioid or narcotic medications for treatment of your chronic painful condition. These medications are highly regulated by the state and federal government, and because of this, there are a number of rules that we must follow in order to safely and legally use these medications. In order to comply with these rules, I have developed two documents which I will go over in this video. It is important that you read through these documents carefully as we follow these rules very closely. The first document is the consent to treat with pain medications. It primarily goes through side effects and risks associated with the medications. Side effects include constipation, nausea, itching, drowsiness, and mood changes. If side effects occur, contact our office immediately. Alcohol and pain medications do not mix. You are not allowed to drink alcohol while taking this type of medication. When we start medication or increase medication, I recommend that you do not drive or operate heavy or dangerous equipment, as your judgment may be impaired. After 24 to 48 hours, if you do not notice impairment from the medications, I do not limit your activities. Again, if you are impaired with these medications, please call the office as a change in medication or dosage may be indicated. The next section of this document talks about addiction and physical dependence. Many people equate these things, but they are really very different. Addiction is a disease. About 10% of the population have this disease, which means that 90% of the population does not. Opioid pain medications can uncover an underlying addiction, but they do not create or cause the addiction itself. It is impossible to predict who will develop addiction, and we monitor these risk factors closely. Things to look out for are inability to maintain the proper use of your medication, taking extra of your medication, taking the pain medicine for something other than pain, and using the pain medication even though it doesn't help and gives side effects. If you notice any of these effects, please contact the office. The second document is the prescription medication agreement. This goes through the rules and regulations of my office in regard to use of these medications. I need to be the only provider that writes pain medications for you. Now, this does not limit you from having treatment in the emergency room or your physician's office. It is only about prescription medications. If you have dental work or surgery or get a cough medicine that contains codeine or hydrocodone, please contact my office. If you know you have an upcoming surgery, please discuss that at a visit so we can discuss how best to manage your post-operative pain. Do not let other people use your medication, and do not use other people's medication. This is actually a federal offense. Secure your medications. People will take these medications, and it is most typically family, friends, co-workers, and service people you would never expect. I recommend that you lock up the medications. At the very least, do not store them in a medicine cabinet or nightstand, as this is where people will look for medications. Take the medication the way it's prescribed. Do not take extra of your medication. If it is not effective or you're having side effects, contact the office. Do not make that decision on your own. Many of these medications are written to be used as needed, so you can certainly take less of the medication, but do not use more, as that may jeopardize my ability to continue to write these medications. If the medications are not effective or you have side effects to them, please contact the office. Do not use illegal substances, including marijuana. It is actually illegal for me to prescribe opioid medications with ongoing use of an illegal substance. Please use the same pharmacy each time. We understand that these days many pharmacies do not stock all medications, and in that case, if you have to use a different pharmacy, please let our office know. We will obtain a urine sample for drug testing prior to starting pain medication. Additional urine drug screens will be done throughout treatment. This is something that is mandated by the state of Texas for the use of this type of medication. It is important that you bring all the medications that we prescribe in their original containers to each visit. We count pills and review the medication bottle, and that is an important part of our monitoring. There are a number of other important bits of information in the medication agreement, and so it is important that you read through that, but this is the highlights. The key to this is communication. let our office know if there are any issues or problems, and we can address them so that there will not be major problems in the future.